Chapter 17, The Pathway of Qi and the Four Cs. The Pathway of Qi. A street is a kind of pathway. Streets in the natural world are for vehicles and pedestrians to pass through. Doctors and healers since ancient times have recognized that there is a correspondence between what happens in the natural world and what happens within the human body. As there are streets in the outside world, so there exist pathways within the human body called Jingluo for qi to gather and flow within. The Neijing recorded that there is a pathway for head qi. One for chest qi. One for abdominal qi. And one for leg qi. It shows that there are internal and external connections, as well as front and back correspondence between the internal organs and pathways of qi in the head, chest, abdomen, and back region. For instance, the pathways of the chest and abdomen region are closely related to the back shu points and the front mu points. The four reservoirs. A sea is a place where hundreds of streams and rivers converge. There are 4 seas in the natural world. Likewise, there are also 4 seas within the human body, namely the sea of marrow, the sea of qi, the sea of water and food, and the sea of blood. The sea of marrow lies in the head. The sea of qi lies in the chest. The sea of water and food lies in the upper abdomen, while the sea of blood lies in the lower abdomen. As far as their division and distribution go, the 4 seas and the 4 pathways of qi bear some resemblance. The sea of marrow lies in the brain, the residence of the original shen. It is the source from where all the shen and qi arise. It also dominates the mental activities and meridian functions. The qi is mainly distributed to points such as Bai Hui and Feng Fu, and they are regarded as primary points for treating brain marrow diseases. The sea of qi lies in the danzhong, referred to in general as the chest. Located in the chest, the lung dominates qi and is the site for ancestral qi to gather. The qi is mainly distributed to such points as ren ying, ya men, da zhui. They are the qi points for treating diseases in the sea of qi. The sea of water and food lies in the stomach, the base site for the nutritive qi, protective qi, qi, and blood to form. The main points, such as qi chung and 足三里, are commonly used for treating stomach-related diseases. The sea of blood lies in the Chong Mai. It starts at the location below the kidney called Baozhong. Ascending, the channel extends to the head, and descending, it reaches as far as the feet. This enables it to distribute qi and blood to the whole body, and hence it is also called the Sea of 5 Zang and 6 Fu, or Sea of 12 Meridians. The chief points in this region are Da Zhu, Shang Ju Xu, Xia Ju Xu. They are the primary points for treating diseases related to the Chong Mai and the Sea of Blood. Qi pathways are branches of the 4 Cs and follow the same pattern when viewed in accordance with the Sanjiao Qi transforming theory. The ancestral Qi starts in the Shangjiao, which lies in the chest. The qi of water and food starts in the zhongjiao, which lies in the upper abdomen. The original qi starts in the xiajiao, which lies in the lower abdomen. The original, nutritive, protective, and ancestral qi together make up the genuine qi of an individual. The genuine qi follows along the meridians and vessels and is called the meridian qi or vessel qi. The brain is the source for the formation of shen qi, which also belongs to the vessel qi. The meridian qi mobilizes and regulates the flow of qi and blood over the whole body. The theory of qi pathways and 4 Cs provides theoretical basis for such clinical applications where the apparently different diseases are dealt with in the same treatment. It has the disadvantages of using fewer points while obtaining quick results, and is highly effective for treating some rare and complicated diseases. Clinical application. Paralysis agitans. Paralysis agitans, known as Parkinson's disease, is regarded as tremor syndrome in the view of the traditional Chinese medicine. As one of the difficult diseases in the nervous system, it is often found in middle-aged and old-aged people. The chief clinical symptoms are tremor, myotonia, and movement restriction. The main pathological changes are found within the substantia nigra and globulus pallidus in the brain. According to the qi pathway and 4 C theory, the brain is where the sea of marrow lies. Upwardly, it extends to the Bai Hui. Downwardly, it reaches to the Feng Fu. Based on the pattern identification principle of traditional Chinese medicine, one can use the following points for treatment. They are Feng Fu, Tai Chong, He Gu, Ren Ying, Zu San Li, Yang Ling Quan. Before acupuncture, the doctor should sterilize both his or her fingers and the patient's skin area around the points. When puncturing Feng Fu, the doctor must insert the needle obliquely towards the laryngoscleroma. Never insert the needle too deeply. When puncturing 太冲合谷, the doctor should manipulate the needle with a uniform, reinforcing, reducing method. When puncturing 人迎, the doctor first pushes the common carotid artery of the neck to the lateral aspect, and then inserts the needle gently. Never inserts too deeply. Yang Ling Quan is punctured using a reinforcing and reduction method. Zhu San Li is also punctured using a reinforcing and reducing method. Retain the needles in the above points for 30 to 40 minutes and manipulate the needles once or twice in the interim. A course of treatment is divided into 6 times and once every day. Hyperplasia of the mammary glands. Hyperplasia of the mammary glands, or hyperplasia of the lobule of mammary glands, pertains to the nodules of the breast in traditional Chinese medicine categorization. It is characterized by pain in the breast, nodular masses in the breast, and menstrual disorder. The disease is found in the chest. As a result of synthesizing Qi pathway and 4C theory, as well as a pattern identification principle, the following prescription is made. 太冲, 丰隆, 三阴交, 天枢, 关门, 人迎, Jiadi, T, 3, 4, and 5. Use the uniform reinforcing reducing method to manipulate the following points. 太冲 for soothing the liver and rectifying qi. 丰隆 for transforming phlegm and clearing the meridian channel. Sanyin-jiao for balancing the liver, spleen, and kidney. Guanmen for tonifying the spleen and harmonizing the stomach qi. and tianshu for releasing qi stagnation. When puncturing ren yin point, the very gentle and shallow method is used. Puncturing ren yin point aids in qi movement and releasing inhibition. Use the uniform reinforcing reduction method also to puncture jiaji, T, 3, 4, and 5 points. Retain needles in these points for 20 minutes, manipulating them once during the session. A course of treatment is 1 session each day for 6 consecutive days. The obstruction syndrome of the heart. The obstruction syndrome of the heart in traditional Chinese medicine includes coronary atherosclerotic cardiopathy, myocarditis, etc. It is characterized by pain in the heart and chest, palpitation, shortness of breath, etc. In light of the Qi pathway and 4C theory, several points on the back are selected as the primary points of treatment. The prescription includes Shen Dao, Jiaji, T, 4, 5, and 6 points. Before acupuncture, the doctor's fingers and the patient's skin area around the points must be sterilized. When puncturing Shen Dao, apply the uniform reinforcing reduction method to calm the mind and clear the meridian. When puncturing Jiaji, T, 4, 5, and 6 points, it is best to direct the needle sensation towards the chest region. Retain the needles in the points for 20 to 30 minutes, manipulating the needles once or twice at regular intervals. Needling once every day and 6 times in total as one course of treatment. Cholecystitis. Cholecystitis pertains to hypochondriac pain in traditional Chinese medicine. It is a fairly common disease in the digestive system, characterized by dull pain in the upper right abdomen or pain extending to the shoulder and back, as well as the abdominal distension. In light of the Qi pathway and 4C theory, the disease lies in the abdomen Qi pathway, and hence several points on the back are selected as primary points for treatment. The prescription includes Jiadi, T, 5 and 6 points, and Yang Ling Quan. Due to the ailment, the patient often feels marked pain when the doctor palpates around Jiadi, T, 5 and 6 points. Puncture these points and manipulate the needles with a uniform reinforcing reducing method. The same reinforcing reducing needling technique is used to puncture the Yang Ling Quan to clear heat and promote gallbladder function. Retain the needles for 20 to 30 minutes, manipulating them once or twice at regular intervals. Treat the patient once every day. A whole course consists of 6 sessions. Calculosis of the kidney. Calculosis of the kidney, or nephrolithiasis, pertains to stranguria caused by the passage of a urinary stone according to traditional Chinese medicine. It is a common disease characterized by acute pain in the loin, which tends to spread to the lower abdomen and the groin. According to the Qi pathway and 4C theory, the disease lies in the Qi pathway of the abdomen. For treatment, the following points are prescribed. Jiadi, 13-14 points, Huangmen, and Zhishi. The patient often feels pain when his or her Jiadi, 13 and 14 points, are being palpated. Use uniform reinforcing reduction method to puncture and manipulate the following points. Jiadi, 13 and 14. 登门 治世 These points are for reinforcing the kidney, expelling the stone, and promoting urination. The electroacupuncture with varied waves can be added. The degree of intensity should be adjusted according to the patient's capacity for tolerance. The treatment lasts 30 minutes. The course of treatment is one session each day for 6 consecutive days. After pulling out the needles, pat the patient around the kidney area, deliberately and lightly to facilitate urinary stone excretion. The idiopathic hyperprolactinemia. Idiopathic hyperprolactinemia, also known as amenorrhea with milk discharge, is a syndrome caused by the increase of prolactin. Most of the patients consult their doctor because of scanty menstruation, amenorrhea, or infertility. According to their locations, the two symptoms, milk discharge and amenorrhea, lie in the Qi pathway of the chest and the Chongmai, the sea of blood. Hence, the main points of the Qi pathway of the chest and the sea of blood are chosen. Prescription option 1 consists of Jiaji T 5 through 9 points, Feng Shi, Tian Zhu, Da Zhu. After due process of sterilization, the patient takes a prone position. Puncture, Jiaji, T 5, 6, 7, 8, and 9 with a uniform reinforcing reduction method. Retain the needles in the points for 20 minutes. Then, with the patient in sitting position, puncture, 大柱 风池 and 天柱, all using the uniform, reinforcing, reducing method. Retain the needles in the points for 20 minutes and manipulate them once during this session. Prescription option 2 consists of 太冲、三阴交、足三里、阳陵泉、人迎、水突。After due process of sterilization, puncture 太冲 三阴交 足三里 阳陵泉 人迎 水突, all points using the uniform, reinforcing, reducing method. The doctor should exercise caution and push the common carotid artery of the neck to the lateral aspect when puncturing 人迎 and 水突. Retain the needles for 20 minutes and manipulate them once in the interim. The above treatment should be given once every day for a total of 6 days as one course.
Manman 披迹相伴